Hello everyone, my name is Lauren, and today I thought I would talk about depression and anxiety and the relationship between the two. So let's go ahead and get started. Now, just a quick note, the focus of this presentation is specifically related to the adult population. Now, some of you may be thinking that the conditions of depression and anxiety are actually different. So what exactly is the relationship between depression and anxiety? Well, depression and anxiety are different conditions, often with their own causes. But the relationship is that they often coexist within individuals. In fact, more than half of the population with depression also have some level of anxiety and vice versa. In other words, people with depression can become anxious about their bleak futures, and people with anxiety disorders can also become depressed due to things such as increased social isolation and increased fears and worrying. Now, here's an example of how anxiety could become depression and vice versa. If anxious, he or she starts to avoid things. Next, he or she begins to isolate themselves from others, followed by becoming sad and lonely, which ultimately leads to depression. On the other hand, if depressed, he or she begins to avoid things. Next, they also become more isolated, thus leading to anxiety and worry, and lastly, develop anxiety. Now, some symptoms of depression include sadness or low mood, anhedonia, which is loss of pleasure in previously enjoyed activities, changes in sleeping patterns, meaning either sleeping more or sleeping less, feeling hopeless, also decreased concentration, thoughts of hurting yourself, which I suggest if you're thinking of this, please get help immediately, decreased libido, irritability, and fatigue. Now, please note, people with depression have some symptoms that are similar to anxiety symptoms and vice versa. An example of some of these symptoms include concentration problems, difficulty sleeping, irritability, and nervousness. Now let's learn more about some symptoms of anxiety. They are restlessness, feelings of dread and worry and impending doom, dizziness, numbness and tingling in body limbs, trouble breathing. More symptoms of anxiety may also include chest pain and nausea. Now, also please note, like depression, there are different forms of severities of anxiety. Now, what other links are there between depression and anxiety? Well, first, it is important for a physician to make the diagnosis of depression or anxiety, or both, within an individual. And interestingly, antidepressant medications also often work well for people with anxiety. Cognitive-behavioral therapy, also known as CBT, can be beneficial for people who suffer from depression, anxiety, or both disorder. It focuses on changing thinking and behaviors. Now, in summary, the most important things to take away are that depression and anxiety often coexist. Also, depression and anxiety have some similar symptoms. Depression and anxiety are still distinct conditions with different causes, and antidepressant medications used to treat depression often have a positive effect on anxiety too. Now, some self-reflecting questions you can ask yourself are the following. Are you experiencing any of the possible symptoms of depression and anxiety? If you have been diagnosed, is your treatment working for you? And lastly, is there a possibility that depression and anxiety do coexist within you? Final note, please be sure to discuss any concerns or questions you have with your physician. Until next time, thank you.